first, it's a great pleasure to welcome back to the program Dr. Art Coday, who's not just a medical doctor, but he's running for the United States Senate. How you doing, Doc?
I'm doing great, Lars. You're my dog in the fight.
Well, I appreciate that. Well, I'm at least not a patient of the doctor's, but I'm glad to have him on because I'd like to know when that Supreme Court decision comes down on Thursday. I'm going to be optimistic about it. I believe the U.S. Supreme Court will see the light and say it is unconstitutional to mandate that people buy health insurance. My next question is, what are conservatives and Republicans like Dr. Art Coday going to do to provide a solution if it's not Obamacare?
Well, that's the right question, and I'm just going to start by saying my opponent, Maria Cantwell, the incumbent, voted for the Patient Protection and Affordable Care Act, and I'm on her website right now, and under her health care statement, her first sentence is, the Patient Protection and Affordable Care Act, passed in 2010, was a landmark piece of legislation, and while it wasn't perfect, it's been a huge win for Washington families and taxpayers. I'm out. It was not perfect. She got that part right. I don't think, much of the rest of the statement was right. The problem is it is patently unconstitutional. And minutes after the act was passed, I released a public statement, in 2010 saying it was unconstitutional because the Constitution does not authorize the federal government to force businesses or private citizens into commerce. The Commerce Clause allows the Congress to regulate interstate commerce, but that is not an authorization to force it. That's at the heart of this bill. That's what's wrong with it, and that's why I hope the court strikes it down. Now, once they do that, then we need to get to the real work of fixing health care in the private marketplace, in Medicare, Medicaid, the VA system. And I've got some good stuff on my website about that I would encourage your listeners to go to arttoday.com. But in brief, Lars, we need to restore the private marketplace. Do you feel like, as a consumer, that the private insurance marketplace is fair?
No, not at all. I would like more choice, and I would like to be buying from exclusively private organizations. I don't want to be forced or even encouraged to buy from a government agency. The only caveat to that would be, and we had a great conversation with some friends over the weekend, the private sector has even provided, I think, Doc, for the, with a little bit of help from government, with a system to take care of those people with pre-existing long-term, chronic, expensive conditions. They created a medical insurance pool that helps to spread those costs out and helps to accommodate those people who've, got a long-term condition. But I'll bet the private sector could probably do that all by itself without the government being involved if we just got the government far enough out of it to let them do it.
I agree, Lars. And one of the problems that a lot of people are unaware of is that the insurance industry has been, to a certain extent, sheltered from antitrust legislation. Your listeners probably are aware of the fact that the Sherman Antitrust Act was passed in 1890, and then the Clayton Act, also an antitrust act, was passed in 1914, and the Federal Trade Commission Act was passed in 1914. But what's interesting is that in 1945, a bill was passed in Congress called the McCarran-Ferguson Act. And what this did was it said, okay, if an insurance company is, registered in a state, as they are, to the extent that the state will enforce its own antitrust laws, the federal government will not apply federal antitrust laws to the insurance company. Now, what I think has happened is that while it sounds good, I think in reality there's been a breakdown. And I think throughout America, in all 50 states, we've had a breakdown of antitrust enforcement against the insurance industry. This is why they can so easily blacklist patients, i.e., knock you out because of pre-existing conditions. This is why they can so easily fix prices. This is why they can so easily go against hospitals and doctors in their negotiation. It has wide-reaching effects, and the effects result in lack of competition, it's anti-competitive, higher prices, fewer choices. Now, what I think we could do to improve the situation would be, A, subject them to the federal antitrust legislation, because I do believe that most of what they do is interstate in nature. And B, I think that we should allow people to purchase insurance across state lines.
I agree.
Much more choice.
I mean, Doc, it makes no sense that anyone who wants to can watch a TV ad and call Geico or Progressive, although those happen to be slightly liberal companies. But whatever. I should have the choice that if I see an ad and say they might do better for me on insurance, I can pick up the phone. It should be the same in health insurance, except that I know people they're going to be thinking, well, no, I get my health insurance through group insurance at my employer. But we've never seen the need or even the desirability of doing group insurance for automobile coverage, although I guess through trade associations like AAA, you could probably arrange that. There's got to be a way to make it that people can buy their health insurance from anywhere in America to be served anywhere in America. I mean, most people are mobile. I live in one state. I work in another state. How much sense does it make to say, but my health insurance can only be purchased in the state that I work in, and then limit that trade so that it's both not competitive and not efficient? Absolutely.
We're totally on page here. And there's another aspect of this that people don't realize either, and it again has to do with the relative immunity of the insurance industry to the antitrust laws. And that is, if you don't have health insurance at all, and you just want to go to a doctor, you got a sore throat, you go into the doctor's office and you say, Doc, got a sore throat, how much is it going to cost? Well, he might not even be able to tell you. He'll have to ask his bookkeeper, whatever. They don't list their prices typically, and it's because they have these complicated contracts that they sign with the third-party payers like Medicare, Medicaid, Blue Cross, Blue Shield, Aetna, etc. And the language in those contracts typically says something like that the doctor will agree not to charge the insurance company any more than his usual and customary rates. Well, that sounds harmless enough, but there's more. The insurance company reserves the right to pay the doctor less than he charges. So if his usual and customary rate is, say, $125 for an office visit for a sore throat, he bills the insurance company $125, but per the contract, the insurance company pays, let's just say, $75. That's all the doctor gets.
Now, Doc, I'm not a lawyer, but that sounds like the kind of antitrust deal that would be illegal. I mean, if a company that uses a lot of automobiles and tires had a deal with Les Schwab and said, listen, we want you to charge us the regular price for the tires, but we'll say that our deal on the backside is because we're bringing all our trucks and cars to you from our business, you're only going to charge us 75% of the regular rate, but you can't tell anybody else that we have this deal on the backside.
That's right. But the patient who comes in who doesn't have insurance and wants to just pay at time of service, he gets the bill for $125 and he pays the full freight. This is so unfair to the uninsured people in America, Lars. They are subsidizing the insurance industry. Why? Because the insurance industry is not fully subject to our federal antitrust laws. I think they need to be. I think it would make all the difference in the world to lower costs, improve choice, make it easier for people to get insurance if they want it, if they don't want it. And if you're young and healthy, maybe you rationally decide you don't want insurance. It'll make the marketplace cheaper for you. This is the way it should be, Lars. And we need the leadership in the Senate to take this one on and go against the insurance industry and their special interests.
Dr. R. Coday is running for the United States Senate against a Democrat who thinks that Obamacare is the best thing since sliced bread. Doctor, tell folks your website again, please.
It's artcoday.com. Last name is spelled Coday, artcoday.com. No matter where you live in the United States, you can donate to my campaign if you're a citizen. I'd love to have your support. Let's get the right leadership in the Senate so that you can have affordable, competitive health care. You're going to win as the patient.
You got it. Doc, thanks for the time today.
Thank you, Lars. My pleasure.
Glad to do it.